going to look at some key points. So this is nothing but some key points in case of the ECT. So ECT we know is nothing but the electroconvulsive therapy. So here we need to know that it produces grand mal episodes. So it can produce the grand mal seizure. So it can produce a grand mal seizure, and this is in case of the anesthetized. It is seen in case of the anesthetized patient. So how does this ECT, the mechanism of action, so how does it work? So firstly, there is a neuroplasticity. There is something known as a neuroplasticity. So neuroplasticity is nothing but the ability of the brain to form and reorganize the sympathetic connections. So if you see the sympathetic connections, they form and reorganize. So this is the effect of the neuroplasticity. So the other mechanism of action is that it increases the brain. So there is increase. It increases the level of the brain-derived growth factor. So it increases the level of the brain-derived GF growth factor and the vascular endothelial growth factor VEGF. Now comes the indication. So where is this electroconvulsive therapy indicated? So it is indicated in case of the treatment. So there is treatment resistant. So the treatment resistant depression. So this treatment resistant depression. Next comes the severe depression. So next comes the severe. So in case of the severe depression, and this is with a suicidal risk. So in case of the severe depression with a suicidal risk, and this is nothing but the most common indication. So the suicidal depression is the most common indication. Next, we are going to look at the depression with the psychotic features. So other indications, it includes the depression. So this is depression with the psychotic. Depression with the psychotic features, and then there is also the depressed suicidal pregnant woman. So depressed suicidal pregnant woman. Depressed pregnant woman. Then there is a refusal to eat or drink. Next comes a refusal. There is refusal to eat or drink. And there is also in case of the immediate risk of suicide. So imminent risk of suicide. Also this is done. Then comes indicated in case of the neuroleptic. So there is the neuroleptic malignant syndrome. As well as can be seen in case of the catatonia. So it can be seen in case of the catatonia. So in case of the catatonia as well as the catatonic schizophrenia. It can also be seen indicated in case of the severe agitated depression. So in case of the agitated depression, so it can be indicated. So here we need to know where is the electrode placement seen. So we are going to look at the electrode placement. So where is this electrode placement done? So the electrode placement is done in case of the bifrontotemporal. Region. So bifrontotemporal region as well as the right unilateral region. Next, what about the anesthetic agent in this case? So what about the anesthetic agent? The anesthetic agent is nothing but there is the methotrexate. And this is nothing but the most common anesthetic. And now we are looking at some adverse effects of this ECT. So adverse effect is that it can lead to the retrograde. So there can be presence of the retrograde amnesia. So retrograde amnesia is nothing but MC, that is the most common. Then comes as a partial anterograde amnesia. So there can be partial anterograde amnesia. Next, they can also be due to the disorientation. So there can be disorientation as well as a temporary headache. there can be presence of temporary headache. Next, we are going to move on to the other important points. So other important point to note is that there can be memory disturbances and they usually recover. So memory disturbances, they usually recover. So they recover by 1 to 6 months. And it is safe in case of pregnancy. So it is safe in case of the pregnancy. And the ECT, it can reverse the extrapyramidal symptoms of the neuroleptics. So we need to know the ECT, what it does is that it reverses the extrapyramidal symptoms. So it reverses the EPS of the neuroleptics, So now we have seen the indications also. Now we will see what are the contraindications of this ECT. So the ECT should be contraindicated in case of, so there is no absolute contraindication, and raised intracranial tension is a relative contraindication. So in case of raised intracranial tension, so there is increased risk of adverse effects. So there's increase in the adverse effects. In what conditions? So the conditions, it includes, there is a severe cardiovascular diseases. So in case of severe cardiovascular diseases as well as a recent MI. Then there is also in case of the space occupying brain lesion, space occupying brain lesion, as well as in case of the recent stroke. So in case of the recent stroke and unstable aneurysm. So this was about the ECT, that is a extra electroconvulsive therapy. To learn and grow more like this, please do subscribe.